Tēnā koutou katoa, ko Mark Lancher tēnei. I'm the medical director here at Hauora Hokianga in Rawene. We've split our service really into what we call a red zone and a green zone. So for the people who we're not concerned about having COVID and just have normal medical problems or accidents, emergencies, those kind of things, we're seeing them in our green zone. Our staff are working here 24/7, and then we've doing a lot more by phone, so a lot more consultations over the phone, sending prescriptions to the pharmacy, so we're trying to minimise our face-to-face contact as much as we can and trying to help people keep their bubbles intact. And then we've got our red zone, which behind us here is part of our red zone. So if we are concerned that people have got coronavirus, we'll bring them in through a different entrance at the back of the hospital here. We've got our testing centre down there that's being run by the public health unit, and you can get tested if you've got any kind of chest symptoms or sore throats, colds, fevers, and you want a coronavirus test. They're open 10 o'clock till 2 o'clock Monday to Friday, and anyone can come and see them. You don't need an appointment. And if they're concerned that you're ill and you might need to see a doctor, you might need some treatment, we'd bring you up into our red zone here, and we've got an assessment room that's just for people to use for that. And then if you need to come into hospital, we've got a little isolation area which is kept completely separate from the rest of the hospital. We're quite a small little rural hospital here. We've got 12 inpatient beds usually, and what we've done is we've got 2 of those are what they call negative pressure isolation rooms. So they've kind of got completely self-enclosed, and they've got extractor fans so that they're our first choice. And then we've got 4 other rooms we can keep completely isolated from the rest of the hospital as well. We can do some lab testing, we can do some respiratory support, we give people some oxygen, there's various bits of equipment we can do that, and we can give people medication, and we can monitor people if they're unwell. We are a small rural hospital, we don't have an ICU unit here, and if people are getting more unwell, we'd aim to get them down to Whangarei, which is our base hospital, where they've got ICU units and ventilators and more equipment and more skills down there. But often, if we think people are going to get unwell, and going to need that kind of care, we'd get them down to Whangarei. But there will be a group of people who we can look after here.